Okay, so we have Sarah in room 14 on labour ward. She's in established labour. She is 30 weeks pregnant. She's a para 2 and she's previously had a preterm delivery. She is 30 weeks and she had a SHROM at 28 weeks. She's had steroids and Magsof and she's now in established labour.
So just to recap, Sarah is come in threatened preterm labour. She's 30 weeks gestation. She had previous preterm delivery at 28 weeks gestation, and you have given 2 doses of steroids, and she had her Magsof.
Yes, that's right.
Thank you. And when is she likely to deliver? Within sort of, what will you say, approx?
She looks like she is labouring relatively quickly.
Okay, so we need to just get our team ready, am I right?
Yes.
Okay. So who we got on the pediatric side? Like we got. So just to say, you will be the neonatal nurse, yes? Okay,
Yep.
I'm the neonatal consultant.
SHO, the registrar.
Yeah, so we got the whole team, the neonatal team. Okay. So now folks, we know that as a trust, we have implemented our policy of optimal cord clamping.
Yes.
That is the delayed cord clamping
Yep.
in babies born below 34 weeks gestation. Our aim is, if the baby is fine and doesn't need immediate resuscitation, we want to optimize the cord clamping to at least 60 seconds. So that will be our aim, provided everything, baby looks well. So we need to allocate everybody's roles who will do. So if I say, if I'm with the baby and the person with the baby's cord and manage the cord side, if you can be my backup, just in case we need the baby to start baby needs help or needs resuscitation. And if you can be with the resuscitator and be ready to receive the baby and assess the baby once the cord has been clamped and baby is on the resuscitator. And Althea, if you can, you will be in charge of starting the clock. And get the saturation probe ready.
Yes.
And will you be our timekeeper as well?
Yeah, that's fine.
So if every 10 seconds, if you alert us, so 10, 20, 30, 40 till 60 seconds.
By 10, yeah.
Okay. And if I'm with the baby, so I'll be assessing the baby and I'll be shouting loudly so that everybody knows where we are and whether the baby needs immediate attention or resuscitation. Is that okay?
Yes, that's fine. And in terms of equipment, as this baby is under 32 weeks, we'll need to use the NeoHelp. The neonatal trolley is in the room as well as the resuscitator.
Okay, and we got the transformer mattress.
Yes, we do.
And we got a hat, baby hat. Yes. Okay.
Do you need the grab bag for that? For under 32, because it's for temperature regulation.
Yes. Yeah. Okay. Any questions? Anybody? Yeah.
We'll make sure that the room is warm prior to delivery and that any windows are shut and there's no fans on.
Okay. Yeah. So other thing is, we haven't had a time to chat with mom or the woman and her partner. So what I will do is we'll come and speak to mom, especially go through our optimal cord clamping, that initiative we've started. Yeah.
Great, thank you.
Okay. Hello, Sarah.
Hi.
Hello. Good afternoon. Okay. I'm Dr. Salgia. I'm one of the pediatric consultant.
And my name is Jackie. I'm one of the pediatric registrars.
Okay. So we are the baby doctors, and we've been told about that you're more likely that you'll be delivering your baby soon in the next few minutes, within half an hour or 1 hour. So we come to speak to you about what our role will be and how we can support the baby after the baby is born. Okay. I understand you had one baby who was born early.
But about 5 years ago.
5 years ago, and I was told it was born. Baby was born at 28 weeks.
That's it.
Yes, yeah. So a lot of things have changed since. More research has come since as to how we manage babies who are born early. So as part of that, I wanted to highlight that we have implemented more changes in line with the current research and evidence. And one of the things is, when the baby is out, the babies are attached to the placenta by the umbilical cord. Previously, as soon as the baby used to deliver, we used to clamp and cut the cord cord,
Yeah.
and we used to take the baby immediately to our
My last
resuscitator.
baby went quite quickly. I didn't
Yes.
see much of him at all.
Okay, so that we used to do. But now more research and evidence has come out that if the baby is doing okay, then we leave the baby attached to the placenta with the cord, so that there is more blood, whatever remaining blood flows through the placenta, through the cord, and the baby gets that last benefit. So that it shows that it helps with the baby's breathing, helps with the baby's circulation, maintaining blood pressure, and the later complications that the baby can have as being born early can be minimized. So there's a lot of advantages now to delay that cord clamping at least by 60 seconds or by 1 minute.
Are there any risks?
There are no risks, but if we find that the baby needs help, that the baby is not breathing or the heart rate is very low and baby needs immediate help in terms of breathing support and all, then we won't delay that. We will be cutting the cord and bringing the baby to our resuscitator and support the baby immediately. So to reassure you that there will be one dedicated one of the baby doctors will be with the babies as soon as the baby is out, so that we start assessing the baby and making sure baby is fine. We will put the baby in like a plastic bag to make sure that the baby remains warm, and monitor the baby so that we make sure baby remains well for at least that 60 seconds or 1 minute till before we clamp the cord and put the baby on the resuscitator.
My partner wanted to cut the cord. Can he still do that?
Yes, should be possible. Yes. Okay. So the whole team will be there. So as soon as there is possibility that you will deliver, we'll be here. Okay. Any questions you
I
have?
think I've asked them all. Thank you.
Okay, baby's out. Let's put the baby in the new help. Okay, clock started.
10 seconds.
Okay. So Althea, you're putting the saturation probe, yeah?
It's 20
The
seconds.
right wrist.
20 seconds, folks.
Okay. Let me check baby's heart rate. Okay, so baby doesn't look white or pale. Okay.
In 30 seconds.
Okay. So I'm getting heart rate now 60 or less than 100, but seems to be picking up.
40 seconds.
Okay, it's coming
Heart rate?
now more than 100, so that's good. Okay, so not to worry. Yes. Okay. You're warm,
You
transform.
said 50 seconds.
Okay. Okay. I can start seeing baby started to take some breaths. Okay. So which is a good sign.
1 minute.
Okay, and heart rate more than 100. Okay, you can clamp the cord and cut the cord.
Okay.
Okay, fine.
Okay.
You're ready to move the baby
Yeah.
now onto
Okay.
the resuscitator. Okay. Okay, so Jackie, yeah, so we have got the transformer now in a sterile bag. Okay, so we put the transformer, it's already warming up. We got the new help, which is sterile. Okay.
But that time we're going to the needle, up again.
Okay, team, we are ready. The
Yes.
baby is coming out. Okay.
So thunder pressure.
Okay, baby is out. Start the clock. Okay.
10.
Let's put the baby in the plastic bag. Okay.
20 seconds.
Okay. So baby looks a bit dusky, but heart rate on palpation
30 seconds.
is getting just towards 100. Probably seems more than 100 now.
Okay.
Okay, baby looks dusky, but not pale, not white. Looks in good position.
40 seconds.
Okay, heart rate is now more than 100. I can see baby making some breathing effort, so baby started breathing, which is good.
50 seconds.
Color is improving. Okay. Fine. Okay, heart rate is
60
at 100.
seconds.
Okay, we can now clamp and
Leaving it
cut the cord.
Yeah.
Okay.
Okay, good to
Yeah.
go.